2. Hello, everyone. I am so excited about today's presenter because, quite frankly, one of my favorite people on the planet. It is the Dr. Mark Sanna, who is President and CEO of Breakthrough Coaching. And in case you're not familiar with them, they're an international healthcare practice management consulting firm. That's right. I said international. And I've had the great pleasure of meeting some of their international clients at their fabulous seminars that they have multiple times a year. In fact, right now I'm looking at the countdown until we get to see each other in Nashville, Tennessee this summer. Dr. Sanna is a second-generation chiropractor. His love and passion for this profession, you can feel it every time you hear him speak, and you see it in everything that he is involved in. The Foundation for Chiropractic Progress, the Chiropractic Summit. He is an author, presenter. He's basically the man. So I'm just going to pipe down, turn it over to him, and let him share his wisdom with us today on multidisciplinary practice. Thank you, Dr. Sanna, for being here today.
Hey, Christy, thank you so much, and what a treat to be with you. Looking forward to being with you in Nashville. Between then, I think we're going to be in Iowa together next week, but one of my favorite things to do is get the ChiroHealthUSA social media post that's where in the world is ChiroHealthUSA. And literally, you guys are everywhere all the time. So I'm glad to see that you're back home for a little while. I know you enjoy being out on the road, but I know you love to be home too. Me too. So I'm going to share a message on one of my favorite subjects. It's multidisciplinary practice. And gosh, when I first started teaching about multidisciplinary practice, it's literally going on 25, 30 years ago. It was super unusual. It was kind of out there. It was like, really, you're going to have chiropractors and medical doctors work together. And now collaborative care, as I like to call it, or integrative care, where we actually have the disciplines of chiropractors, medical physicians, acupuncturists, nutritionists, all working together for the goal of delivering the very best care to patients. Now, that's mainstream. It's actually not only mainstream, it's now recommended, and it's being recommended by some pretty serious regulatory bodies. And collaborative care is kind of the buzzword now. You're hearing that more and more, and I'm going to give you a little bit of the history of it, and then some of the things you want to know about if you're thinking about doing an integrated practice in your own practice setting. Gosh, since the opioid epidemic and the crisis that has confronted the American public, the global public has reached the proportions that it's at. Traditional medicine is looking for answers, and patients are looking for answers. And folks who have been put on this horrible path of opioid addiction are looking for help. Medical doctors who really had only in their toolkit opioids to be able to help people deal with chronic pain are now looking for help. And chiropractic spinal manipulation, the adjustment, is now at the forefront of aiding and being the solution to drug-free pain management. And what a tremendous journey that's been. So I'll take you back in time a little bit. Back in, 2005, that was quite some time ago, I had already been doing multidisciplinary practice and coaching multidisciplinary docs across the country for some years, and received a call from the team of attorneys at the American Chiropractic Association, and they wanted to put together a guideline or policy statement for multidisciplinary practice. Now, this is way back when. Again, this was way before the opioid epidemic was heard of. There are all sorts of different misinterpretations about what multidisciplinary practice is, what multidisciplinary practice isn't. And the team who I worked with to put together this policy statement, we presented it at the House of Delegates at the National Legislative Conference, NCLC, in Washington, D.C. It was the first policy statement of its time that really sets down the do's and the don'ts of multidisciplinary practice. It has held true since then, and so I like to tell doctors, use this document. You can download it from the ACA. You can get it from Breakthrough Coaching. Use this as your divining rod. This is as your tool to say, is this right or is it wrong? If it's not in this statement, don't do it. Pretty simple. I'm going to make it even simpler than that. And because there's a lot of misunderstanding about what is correct or cool or right or legal in a multidisciplinary practice and what isn't, I'm going to let you have two very significant rules of thumb that you can apply to anything that I'm going to teach you in this webinar, that you can apply to any of the procedures that you might hear or learn from a buddy or somebody at a local meeting, or you might be on the phone with a consultant. And you can hold up this magnifying glass to it, and if it answers these two questions, then good. If it doesn't, then walk away. And question number one is, does this procedure, does what I'm being taught to do, does that exist or does it occur anywhere else in healthcare other than within the four walls of my practice? In other words, if I'm told to do this, is every other group medical practice in my community doing the same type of procedure? If they're not, then skip it. The other guideline, hard, fast guideline that I'm going to share with you, and you can take this one to the bank, is that if it sounds weird, if it sounds illegal, if it doesn't feel right, if it sounds like it might be fraudulent, it is. So walk away from it. Listen, I know that it can be challenging now, more challenging than ever, to generate a revenue that supports the type of a lifestyle that a chiropractor deserves, a doctor of chiropractic deserves, after $200-something thousand in investing in your education, plus your practice and your staff and all of the overhead that you face. And yet all of that can quickly disappear and evaporate if you don't do it correctly. So download that ACA policy statement. Multidisciplinary practice is a level of business that is much more complicated than it is to run a solo chiropractic practice. Now, I'm not saying that it's easy to run a solo chiropractic practice. That's a business. It's an entrepreneurial business as well. The buck stops with you. We don't make payroll. You don't get paid first. We got to keep the lights on, right? We got to make sure we have proper patient volume, that we're keeping up with all the coding and compliance regulations that are there. But when you are dealing with multiple disciplines, multiple licensed disciplines, in a group practice structure, there are now a completely different set of regulations called the Doctrine of the Corporate Practice of Medicine that is quite unique in each individual state, that govern what can be done and may not be done in a particular state. There's also another set of regulations called the Stark regulations, after Congressman Pete Stark, that again govern what can and cannot be done between physicians working together in a group, how we can or cannot refer to each other, how we can or cannot be reimbursed or share in the profits of a group practice. These are very significant. When I say multidisciplinary practice is not a time to wing it, this is not a DIY, do-it-yourself project. This is something where you need professionals. You need a multidisciplinary professional team. That's a consultant like myself. It's an attorney. I'm going to give you some guidelines for selecting the correct attorneys. It's also a financial decision, and so having a financial planner, an accountant who is familiar with multidisciplinary practice structure is absolutely essential. Reason being, if you don't do it right, you can make some money on the short term, but consider it a loan because you're going to end up paying that back, and you don't want to have to pay it back with fines and penalties and possible needing to defend yourself against criminal charges. Not so cool, right? I tell docs, listen, look at yourself in the mirror, see how you're dressed in your nice professional outfit, think how you look picking up trash on the side of the road in an orange jumpsuit. Probably not your best look. So my advice to you is do it right. Keep it straight. So getting started from step one. Once you can run a successful chiropractic practice, in fact, if you came to me as your coach in Breakthrough Coaching, you said, Dr. Sanna, I'd like to become a Breakthrough Coaching multidisciplinary practice client, and I want you to coach my practice, I'm first going to interview you to see that you first can run your chiropractic practice successfully. Because if you can't do that, adding on the additional layers of legal work, paperwork, regulatory work, professional interaction and collaboration is not going to cut it. So making sure that you have a successful, and we'll coach you. If your chiropractic practice isn't up to a successful level in terms of being able to financially support a multidisciplinary practice, we'll have you tap the brakes, and we'll coach you as a chiropractic practice until you're ready, and then we'll say, okay, now let's get started. And getting started, as I mentioned before, is first of all putting together the correct corporate structure. Now, the corporate structure is, again, defined by the corporate practice doctrine in your state, and that varies completely. So I'll give you some examples. So down in the state of Florida, a chiropractor can hire a medical doctor, work together, just like a chiropractor could hire a chiropractic assistant or any other staff member. There's no specific special corporate structure in terms of ownership of that practice. You have to have a proper practice charter set up, but the ownership interest in that practice can be 100% owned by the chiropractor in Florida. Lucky the chiropractors in Florida, right? Let's take it to the other coast, California, or let's take it up north to New York. A chiropractor may not own any percentage of that multidisciplinary or medical practice. And that is because in those states, a medical physician must own 100% of that practice. And that requires a corporate structure that is more than a single corporate entity. It involves creating up a professional entity for the medical practice that's owned by the medical doctor, and then typically an MSO or management company, a management service organization that can be owned all or in part by a chiropractor. And how those companies can work together, again, is very regulated. Once again, not only a legal issue but also a financial issue that the invoicing between those two corporate entities has to be done in a very, very specific way according to specific guidelines. And then in between, there are grades of difference where the percentage of ownership in a single corporate structure, for most cases, it's going to be a limited liability company, LLC or PLLC, a professional limited liability company, that can be owned in part. In some states, it can be 50-50, some 49, 51%. The point is that you really must be sure how that practice should be structured in your state. And if somebody tries to paint a brush stroke and say, well, listen, it's easy to do, just hire a medical doctor. Again, you've got to make sure that you have the right legal counsel. And from a breakthrough coaching standpoint, we're going to point you in the direction of something called a NACA attorney. And a NACA attorney is your state associations, your state chiropractic association's attorney. NACA means National Association of Chiropractic Attorneys. They'll know the ins and outs of multidisciplinary in your practice. And if they're not the person who's going to set that up for you, they'll make sure they point you to somebody who not only knows healthcare with group practice, including chiropractor and medical or physical therapy in your state, and not just a healthcare attorney that doesn't have your specific state information. So our commitment, for 20-plus years now, I've taken the most conservative approach to multidisciplinary practice management. Christy mentioned, I'm a second-generation chiropractic. It started when I established my first multidisciplinary practice way back when, and one of the doctors on staff was my dad, and I wanted to make sure that nothing that was done in that practice could in any way tarnish the reputation of my dad, who was one of the founders and pioneers of chiropractic in the state of Connecticut. And I was not only concerned, of course, about my reputation, my personal reputation, but also for my dad. And so I knew I wanted to play it straight. I knew I wanted to play it conservatively. That's how we founded our multidisciplinary program. What I teach you are things that I've done in my own practice that breakthrough coaching members have done for decades across the United States, and that you can rest assured. I call it the pillow factor. Maybe you've heard me say the pillow factor before, and I chuckle because that means you can put your head on your pillow at night and sleep soundly knowing that you've done it right, and you don't have to be constantly flipping the pillow over to the cold side because you can't get to sleep. So do it conservatively. Do it with the right intent. So while a multidisciplinary practice can throw off significant income, significant revenues, 3, 4, 5 times what a solo chiropractic practice can generate, it sure isn't worth it if you're not doing it for the right intent, and that is to deliver the highest quality of care to your patients, respecting the scope of each individual discipline, and creating this collaborative team approach to care. So dotting the I's, crossing the T's, making sure that you are sticking to what's right, right? What's right is right. What's wrong is nothing, says my buddy Dr. Terry Yoakum. So it's not legal sleight of hand You can't just sprinkle wiffle dust over your chiropractic practice and turn it into medical practice with a wish. It's also not a method of increasing reimbursement where there's limited chiropractic reimbursement. If chiropractic benefits are limited in a particular plan, well, they will continue to be limited even after you're a multidisciplinary practice for that chiropractic provider. It does provide additional revenue streams through additional professionals, additional service centers in that practice, but you're not going to get coverage for chiropractic care for adjustments when they're not covered in the original benefits package just because you're now a multidisciplinary practice. Multidisciplinary practice is created for the benefit of the patients. We talk a lot about a patient-centered approach to care, one that is evidence-based, one that follows the accepted guidelines and standards of practice of your profession. This multidisciplinary practice, when I first got involved with it was like, gosh, back then the medical doctors wouldn't even play golf at the golf club with the chiropractors, right? And now the silos of collaboration have been broken down, where the two professions really did not interact and engage with each other, certainly at the level of an individual practitioner. Now we're seeing the educational institutions embracing collaborative care, so that young upcoming medical students and young upcoming chiropractic students are being taught how to communicate with, integrate with, work together for the benefit of the patients. My alma mater is New York Chiropractic College, and New York has been on the forefront of integrative medicine. It's one of the few clinics where a young chiropractic student is going to actually be exposed to Chinese medicine and also be exposed to medical care, because they run their clinic as a fully integrated practice, so that when those students come out into the real world, they know how to write a report to an MD. They know how to work together. They know how to collaborate. And it is a really neat thing that if your goal in your practice philosophy is to have the patient express their greatest level of health and wellness, that actually being able to manage a patient off of the drugs that they're on. And by the way, if you don't think that your patients are taking multiple prescriptions, you're not looking close enough. The use of sleep medication alone is off the charts in the number of patients who are taking antidepressants and sleep medication and cholesterol medication and beta blockers. And as they receive conservative care through chiropractic, through acupuncture, through nutrition, the need for those medications or the levels of those medications decreases. Many times they come off them completely. When you can manage that patient together as a team, truly manage their health, and not have the patient have a medical doctor across town who's not, one medical doctor's not talking to the other medical doctors, not talking to you, the chiropractor, that is a mess. And that is the current state of health as it exists today. When your parents turn to be seniors, citizens and seniors, and you're out there, thank God I have two great sisters who love and support and, coming from a great Italian family, we all are there for each other, always family first, right? Managing the health care of your patients, parents as they get to be elderly patients is tough. And knowing that their medical record is kept in one place where it can be centrally accessed, where it can be referred to from the multiple providers versus having to go all the way across town. And it's not easy for them to travel across town as it is. Not easy for me to travel across town. Forget about my parents in their 80s. But their time, their efforts, their energies, and man, sitting in waiting rooms is not fun. And so being able to deliver the services that people need, by the way, that they are receiving in your community, whether they're getting them from you or not, in one location with people who really love and care about you and deliver the highest quality care is the goal of correctly integrating your practice. So let's talk about some of the paradigms for practice that are out there. Got a little graphic of a mouse going after some cheese in a maze up on the screen right now, and it reminds me of the book, Who Moved My Cheese, right? Cheese keeps getting moved. And I'm going to give you 3 paradigms that exist right now, I don't care where you live, in your community. Let's see if any of them seem familiar. Paradigm number 1 is the chiropractic-only practice. These are chiropractors who believe chiropractic and nothing else. We can do anything. We can cure anything. They rarely refer out. They are typically seen as back or neck pain specialists. Unfortunately, that is a pigeonhole. And if you don't think that's a reality, explain to me then why are only 10 or 12 or even on a good day, according to Palmer Gallup, 14% of patients are accessing chiropractic care. Why? Is because they see you as a specialist. They don't see you as a generalist. They don't see you as the first primary portal of entry into the healthcare delivery system. They see you as people who treat back and neck pain. If they don't have that, they don't need you. And 9 out of 10 cars are driving by your parking lot every day, primarily going into the PCP's office with even their low back and neck pain. Primary care doc has no idea what to do with that. In fact, they don't have anything that they can do with it. NSAIDs, and used to be able to do opioids, can't do that anymore. Where are those 90%, those other people going? How about having them come into a chiropractic multidisciplinary practice, a collaborative team? The great news is that even these type of practices, or chiropractic only, never refer out, right? They still get tremendous satisfaction survey results. So chiropractic patient satisfaction surveys, again and again and again, are at 95% satisfaction. Once we get patients, they love us, they get well, they think we're cost effective, they refer their friends and family. It's a great thing. We just only get 10, 12% of them. Paradigm number 2, it's the opposite. This is the medical-only practice. You've got them in your town, the PCP, the urgent care center. Their focus, very interesting. When you look at how a medical practice manages, even if it's a hospital, how they manage patient care is they look at the chart first. They look at the lab results, and they look at the patient's numbers. And then from the patient's numbers, they then move and they look at the patient. Chiropractic is exactly the opposite. We look at the human being. We look in your eyes. We look at the color of your skin. We look at how straight you're standing. Look at how far your ears are in front of your shoulders. We look at you as a whole being, right? We don't just look at the numbers. And, of course, the answer in a medical-only practice is either cut something out of you or put something into you. So it's a lot of drugs or surgery. And if you want to meet an unhappy guy, or at least a really stressed out guy or gal, go down to that urgent care center. By the way, you're not going to find a medical doctor in the urgent care center. It's going to be a nurse practitioner or a PA. Go to the hospital. These people are stressed. You think documentation is difficult as a chiropractic practice? Do you think coding and compliance and the stress of the need to see volume is high on a chiropractic practice? Let me tell you what. Go stay for a day in an urgent care center, and you'll see why medical doctors absolutely love working in a multidisciplinary practice with chiropractors. It's a totally different paradigm. It's uplifting. You think, why? Why would a medical doctor ever want to work there? Because they hate working in the medical system. The healthcare system right now, it's broken. It's challenged. And its focus is on crisis care. So they are in constant crisis mode. There's not a lot of hugs and loving and pats on the backs and the miracles that happen every day in a chiropractic practice. Imagine being able to create something like the third paradigm. And that's a patient-centered, wellness-based, multidisciplinary practice. What do I mean by that? It's a practice that sees health as a function of lifestyle. That lifestyle is a component of habits, and habits over time become structure, and a lack of movement, a lack of proper eating, a lack of proper lifestyle results in a lack of health. And this paradigm, the paradigm that we embrace in breakthrough coaching, that I do when I teach collaboration, is very, very attractive. I had the great honor recently to be invited to speak in New Jersey at the New Jersey Doctor-Patient Association. It's the first organization in the country that was created by both chiropractors and medical doctors together. And the Doctor-Patient Association up in New Jersey is sick of the status quo. They're sick of this sickness paradigm that has been thrust upon the American population by insurance carriers who really aren't looking at health as a vital life, but as managing a bottom line, right? How nice to create this healthcare practice that has a focus on creating lifetime family wellness. So let's talk about how we build a practice. You decided, all right, well, this sounds interesting. Collaboration sounds interesting. I think it would be cool to have MD, PA, nurse practitioner, physical therapist maybe on my practice team and actually work together. That would be something I'd be interested in. And okay, I'll research how to do it properly in my state, and we'll help you in terms of, where do you find a medical doctor? We'll help you find one, and we'll help them help interview the process, just like hiring any other staff member. In breakthrough coaching, we're really big on having an associate-driven practice, multiple associates in your practice. It's a great way to practice. And so just like we'll help you interview an associate for your practice to make sure that there's a right philosophical treatment approach, mesh with your own philosophy and treatment approach. We'll do the same with being a medical physician or nurse practitioner or PA. They each have their own different philosophies, and I certainly want to be sure that we're working together. And I want somebody just like any other member of my team that's going to be a team player, that's going to work with us, work together for the patients. I want them to know that we are going to be co-managing our patients, and that means we'll have team meetings. We're going to review the charts. We'll have what's called a transparent medical record. We'll be working off the same chart, right? That Mayo Clinic or Mayo model, which I absolutely love when, God forbid, something goes wrong, having that collaborative approach can really uncover things that a solo practitioner, be it a neurologist or an orthopedist or a chiropractor or an endocrinologist alone, can't uncover. Having all of those specialties being able to take a look at a diagnosis or misdiagnosis and correct it is pretty significant. So we'll help you do that. So let's talk about some of the nuts and bolts. I mentioned before that multidisciplinary practice is not a sleight of hand, and just to reiterate, that means that whoever does the service in your practice, that multidisciplinary practice, the person who is the clinician who performs that service documents it in the patient record, charts the note, and it's billed out under that particular provider number, right? So chiropractor does an adjustment. It's billed as an adjustment under the chiropractor's NPI or their provider number, and it would never be billed out under a medical physician's license. As I mentioned before, if it doesn't take place anywhere else in the world, then it should not take place in your multidisciplinary practice. It's the same thing. There's nowhere in a hospital or medical practice in your community where a chiropractor is billing underneath a medical doctor's license. Now, Christy mentioned in my introduction that we are an international organization in breakthrough coaching, and we are. And that means I actually coach practices in countries where chiropractic is still illegal. And that means we are working with those organizations in those countries so that chiropractic does not have to be billed under a medical doctor's license, that chiropractic license is recognized as it is in the United States as being a physician-level license. And it's not required to be billed underneath a medical license. So don't only do that because it's illegal. Do it because your profession has fought for you to be able to be seen at this level of professional acknowledgement and recognition and licensure. And never do that disservice of hiding chiropractic. Same thing, PT, physical therapy services, billed underneath the physical therapist. They can have a PTA, physical therapy assistant, work under them. States now have DPTs, doctor of physical therapy, where a patient can have direct access for 30 days to a physical therapist. Some states, and after that, every 30 days, that prescription for therapy services needs to be updated. Some states it's required from the get-go, so be aware of that. This is all a conversation about incident to billing. So that means when one license bills incident to another professional license. For example, when there's a supervising medical physician that supervises a nurse practitioner or supervises a physician's assistant, that's called an incident to billing, and that's normal. That's how it's done, right? So that the medical physician supervises the incident to billing of the PA. Some states that can be done with physical therapists. Whoever's billing incident to anyone, They're identified on the documentation. Their provider numbers are identified, and just like the chiropractor, they're not made to disappear or not exist or be hidden behind a medical license. So let's hop into a little bit more of the multidisciplinary practice compliance, legal compliance. First of all, I'm not a lawyer, right? However, I did say at a Holiday Inn Express last night. No, I'm kidding. I'm not a lawyer. I'm not going to dispense legal advice. For legal advice, I'm going to point you in the direction of the NACA attorney in your particular state, or to an attorney that you might work with who knows group medical corporate practice doctrine in your state, because it is, again, as I mentioned, very, very unique. So we want to make sure we tee it up correctly from the get-go. Here are some things to look out for, be aware of, kind of stuff that's actually happened in multidisciplinary practices in the past. I bring it up. You're going to hear some of this stuff. You'll be like, what, are you kidding? Somebody would actually do that. And the reason I'm bringing it up is because, yes, they have done it, and yes, they are still doing it. And my advice is, if you know somebody who is, tell them stop. Don't do that. Ghost-owning doctors is where a medical doctor in a state that requires medical ownership of the professional corporation is an owner in name only. They're paper doctors, or we call them ghost-owning doctors. We call them a ghost because they ghost. They've never been in a practice. They've never had any type of a fiduciary role or financial role over that practice. They may have never made a financial contribution. Now, try forming a corporation without a financial contribution. Again, there's that rule. If it doesn't exist anywhere else in the real world, you can't do it in your practice. So that medical doctor must have a bona fide role in that particular practice. They actually have to do what they're supposed to do, even if it's for corporate hygiene, that they must, as in any other corporation, do their job. As I mentioned here on the slide as well, all stockholders of the professional corp, the PC is professional corporation, PA is professional association, should make a financial corporation to that contribution. If anybody ever comes and looks at your corporate documents and they see that the medical doctor was gifted an equity stake in the corporation, they're going to question the legitimacy of that corporation. It pierces the veil of corporate protection that we incorporate for, and leaves you personally liable. That's not cool. Blended billing. This is where you take all the services, chiropractic, physical therapy, massage therapy, whatever, throw it in the Vitamix, pulse it a couple of times, and you pour it out, and it all comes out under the medical doctor's license. That's not cool, shouldn't be done. He who doeth the procedure documenteth the procedure and is identifiedeth on the claim form as being the person who did it. Federal insurance, Medicare, Medicaid, has a whole separate layer of regulation. I mentioned the Stark regulations before. Those are important to note. Also, there are some staffing requirements. Medicare, Medicaid require federal plans, Federal Blue Cross Blue Shield, for example, called the 75% rule, which is a calculation of all of the hours that are spent in practice within that group practice and outside of the group. They have to mesh up to 75% in order for you to be able to be reimbursed by a federal health care plan. If you don't meet that 75% staffing rule requirement, then you may not do federal work, right? So that's really key, especially as seniors are one of the greatest demographics in the history of healthcare, and that seniors are hitting the healthcare pipeline at greater numbers every year, that if you want to be able to provide care for those patients, senior citizens under Medicare, you've got to have proper staffing requirements in place. Breakthrough Coaching will help you determine that. Standing orders. This is Looney Tunes. This is crazy. Somebody really thought of this. And the standing orders were taught like this. Okay, the medical doctor's not here, but their medical doctor is going to leave a document called a standing order that says that a chiropractor can triage the patient underneath the medical doctor's license and has permission to do that, and we will bill for that as though the medical doctor performed that examination, even though he wasn't on premises at the time. And these standing orders allow that to happen, and there is no such thing as standing orders. And if somebody taught you to do that, or if you're doing that, stop. Diagnostic testing. So diagnostic testing, again, is a unique area when it comes to these stark regulations that involve things such as the anti-kickback statutes, anti-inducement statutes, fee-splitting statutes that control the economics, the finances of healthcare. And there are numbers of firms that are in the chiropractic profession that actually will come to you, and they'll say it in a very, convincing voice that is something that you might believe, that they'll pay you per test that you do, or they'll pay you per, amount of floor space that they use, I guess, something like that, to do typically neurodiagnostic studies, diagnostic ultrasound, things like that I've seen, NCV, SSEP, that kind of stuff. Again, don't do that if you're doing it. If you are doing it and there's a contract that is in place, make sure that it's been read by your NACA or a healthcare attorney so that it is compliant with any Stark safe harbors that are in place. Those are the guidelines of what you can and cannot do according to the Stark regulations. By the way, there are various states that have many Stark regulations that are at the state level, Stark regulations at the federal level, but a lot of states have mini Starks that you want to be aware of. So paying for equipment or technicians on a per test or a volume basis violates the Stark regulations. An additional point put here on this slide is if you have a medical practitioner who's working with you and that MD orders x-rays, let's say you have a great digital x-ray set up in your practice and medical doctor orders them, in the real world, that MD would have those films overread or read by a radiologist. Most primary care docs really are not proficient with reading x-rays, and so my recommendation is have those films overread. I like to have any films overread by a DACBAR diplomate of the American College of Radiologists, right? But if you're going to have them taken and they're going to be billed under a medical physician and you're going to bill for an interpretation, make sure that that doc is able to do that type of an interpretation. No bouncing, the kangaroo for my Australian friends up there. Bouncing is, again, Stark regulations. That's a patient bouncing from two tax ID numbers. You could call this double scooping, right? The Stark regulations say that an owner of a healthcare entity may not financially benefit from a patient in two entities that they have ownership over. So if you have a chiropractic tax ID number, to be specific, and then a separate medical tax ID number, and you bill partially for some of the care the patient receives underneath the chiropractic tax ID number, and then they bounce over and they receive care under the medical tax ID number, but because you have a management organization, you're actually benefiting from that medical care that the patient's delivering there, and you're benefiting financially from the care that the patient's receiving under your tax ID numbers. That's not cool, right? Multidisciplinary practice is a group practice. Everybody who's co-managing that patient, regardless of the corporate structure, has an employment agreement. They're all working under a single unified tax ID number. And bouncing from one to the other is not cool. If you're doing it, stop. Duplication of services. I call this pick one. If the patient is being seen by a physical therapist and they're receiving manual therapy 97140, and that's being billed under the physical therapist's provider number, and then on another day they're coming in and they're seeing the chiropractor and they're receiving manual therapy 97140, and that's then being billed under the chiropractor's provider number, that's duplication of services. Questionable necessity for that. Pick one, stick with it. And one of the great things about this multidisciplinary practice collaborative team approach is that as a chiropractor, you're doing what you do best and what you love to do best, and that's adjust patients, see patients. And other services, physical therapy services, for example, are referred out to a physical therapist to do. So you actually become the straightest of straight chiropractors because you're doing what you love to do. That's adjust patients. It does require a treatment protocol in place. You call it a treatment map. You could call it a guideline that the practice agrees on, that we're going to collaborate together, that one provider is not seen to direct another provider in care. In other words, as a chiropractor, I can't tell a medical doctor what to do, or medical doctor shouldn't tell me what to do either, that we actually work together and co-manage the patient. That's a big deal. And one of the things that we help you do in breakthrough coaching and train your professional staff on is this treatment protocol. Goes to say you got to have a compliance program in place. It's important if you're a chiropractic practice, solo practice, even more in practice when you're having multiple licensed providers in place. Compliance program is a living, breathing series of trainings and internal audits and a program of improvement. If that's not in place in your chiropractic practice, you need to get that up to speed. And in a multidisciplinary practice, it's even more essential. So let's talk for a minute or two about the chiropractic-only practice to a multidisciplinary practice. Number one, establishing your corporate structure. Once you pick the correct one, you're going to have to set up a new tax ID number. You're then going to have to credential your providers. That's a big deal. In some states, if you're a chiropractic entity, you may need to change your corporate charter. Those are questions that we can help you with. Certainly, if you're a provider on certain panels, HMO or PPO panels, you want to, again, credential your providers with that panel. You want to let them know that you're adding different services to your chiropractic plan. And we want to make sure that they're aware of our altered status, or do we need to re-credential as a group? And sometimes that happens. So being clear on what's your procedure for changing a provider or a group's EIN is super important, and breakthrough coaching will help you do that. So who's going to see the MD or the physical therapist if we've now had them join our chiropractic staff? Well, guess what? It's up to the patient. Remember, patient-centered is patient choice. You're going to have patients who come into your practice who will only be receiving chiropractic care. received chiropractic maybe for some years, see you for wellness care. They might not have a need for a medical doctor. We let our patients know that, in fact, we allow them to make that choice. So, super important that nobody has to see the medical doctor. We let our patients know, hey, we've got the eyes and the hands of the medical doctor, the eyes and the hands of a chiropractor, and we're working together to deliver the very finest care available to you. Patients love that, right? We let them know also that we're not here to displace any of the specific medical relationships that they might have, currently existing relationships, if they want to keep them in place, that our collaborative team, our integrative practice, is here to help them for the condition that they're seeking care for right now. Super key. We do team conferences. I mentioned this before. Once on a periodic basis, all of the members of that co-managing team are meeting together, and we want to coordinate care, making sure that we're best using our resources for the patient. That breakthrough coaching protocol is part of the secret sauce. It's a key thing for you. It helps with management of an ideal patient. It's not cookie cutter, but it lets everyone know what page they should be on so that we don't have a three-ring circus, right? We want to make sure that everybody's on the right page. So there are some neat things you can do if you do have a multidisciplinary practice and it's clicking along to bring it to the next level, right? Adding these new staff members to your practice allow not only different levels of insurance reimbursement, but some new cash services as well. Once again, make sure you cross your legal T's and dot your legal I's and do it the right way. So normally your services will start with physical medicine that is very similar to what you do in a chiropractic practice, sort of adjustments plus rehab. Then you can move to trigger point injections for pain management, even then to joint injections, right? Once your provider is trained in these particular procedures. Nerve injections and blocks are also very commonly delivered in a multidisciplinary practice, and those are typically done under the guidance of ultrasound for needle placement. Sometimes fluoroscopy is used. C-arm is kind of an X-ray unit that allows us to have special imaging approach. Once we can do injections and ultrasound, then we can enter the world of Regen Med and regenerative medicine. Gosh, that is such a hot topic. These are therapies such as stem cell therapies, PRP, platelet-rich plasma, A2M, alpha-2 macroglobulin injections that can all be done by a PA or nurse practitioner under the supervision of a medical doctor. They are the cutting edge of therapies. In the past, if you can imagine, if you tore a ligament in your knee or shoulder, you'd have to have a surgery to replace that or bolt it back together. Now you can use the body's own healing power to create a healing situation. Cool stuff, really neat happening. Regen Med is really at the cutting edge and the forefront of healthcare. Those boomers are out there, they're looking for it. Regenerative medicine practices are some of the most sought after services in your community. So what does breakthrough coaching do for you? Well, I'd mentioned we'll help you recruit and find your medical doctor, help you find your PTs, help you find the right attorney, and help train each department in its own discipline. We help with interprofessional communication. That means your accountant, your attorney, professional staff, your financial planner. As you're earning more money, you want to keep it. We'll help you get advice on supplies and equipment, help you on capitalization of what kind of money do I need to be able to convert, those administrative protocols, billing and coding protocols, and then marketing that practice is an acquisition of new patients, developing relationships with community-based physicians, and then, as I mentioned before, super important, the creation and development of a quality assurance compliance program for your practice. Hey, I've got a gift for you. I know that you've listened to a lot of information here. I want to give you a multidisciplinary practice guide. It's an ebook that you can download by texting CHUSA, 319 to 33444. Text CHUSA 319 to 33444, and we'll send you a copy of our ebook. Hey, Christy, thanks so much for having me and allowing me to talk about this subject that I'm so passionate about.
I am so excited that we were able to make this work with your schedule. Y'all, he talks about how much I travel. It is nothing compared to the amount of work that Dr. Sanna is doing when he is zipping all over the world. It's just absolutely crazy. We have one question that, if you don't mind taking a minute to answer.
Sure.
And it says, are stem cell injections part of what you consider regenerative medicine?
Yes, stem cells are part of what's considered regenerative medicine. Regenerative medicine really is a treatment path, and knowing which product to deliver at which place and at what time is essential. So you might start up with an irritant therapy like a PRP and then move into something like an A2M, alpha-2 macroglobulins, kind of the Pac-Man that eats up the active components of arthritis before ever attempting a stem cell. Not every candidate is going to be appropriate for a stem cell. They may be too old, their stem cells might be worn out, and they might be better using something like an exosome. Exosome is the communication packet that stem cells send to your own tissues to help them regenerate, hence the name regenerative medicine, into new and healthy cells. And so knowing what to apply, where to apply it, and when to apply it is all part of the field of regenerative medicine.
Excellent. Well, thank you so much, Dr. Sanna, and thank you to all of you for joining us today. Just a reminder, we have a big month next month. We're going to be covering all kinds of topics for marketing for Posture Month in May, how to sell your practice as you're gearing toward retirement, and I think that there's never any time too early to start thinking about that, how to help your staff reduce their stress at the front desk, how to communicate science appropriately in chiropractic practices with my dear friend Heidi Havoc. So excited. And then the sugar addiction, which is huge in this country. So lots of good stuff coming in April, and we are about to release the speakers for May and June. So make sure you go on the website, check that out at ChiroHealthUSA.com/webinars, and I promise that you will see Dr. Sanna back here again later this year because, well, he's one of my favorite speakers and just absolutely amazing. So if you're in Iowa, we hope to see you next weekend while we are there. We'll be speaking on Friday. And if you're looking for a great destination vacation / seminar, we will be in Nashville, and you can check all of that out by looking on the ChiroHealthUSA homepage and looking at travel, or you can go to mybreakthrough.com and click on seminars to see where Dr. Sanna is going to be at a city near you. Thank you.
Thank you so much, Christy. Have a great day.
Dr. Sanna?